Okay, today I'm going to show you a release for when your back is tight. This is something that you can do every day, like after you get off work, before you go to bed, and it will really help to relax your back and shoulders and even your neck because it helps the whole spine and the pelvis and low back. So I'm going, hopefully, this microphone, I keep trying different microphones and I don't know how well they're working. But anyway, I'm going to show you this one. Um, and I will try to speak loudly enough, and you can just follow along as I do this exercise, which I do quite frequently. Okay, so I'm going to put my feet up on this box, and what this box is a foam rubber pads. They're 16 by 4 inches deep, and there are four of them together. And I made this for clients who cannot keep their feet up, or I can't hold their feet up. So what I'm doing is getting my knees right to the edge of here. And so you're laying flat, so you should just lie there for a few moments. Maybe you should have some soft music on just to relax yourself. So I'm just going to lay here for a minute and let my back kind of sink into the table. This can be done on the floor. If you can't get on the floor, that's why something like this would really be helpful. So I can use a hammock. If you can position yourself where you can just lay there and relax for a while, it just feels so good. You may put your arms out like this if you care to. That feels good too. It helps your shoulder blades to kind of go into the table. Just they press into the table gently. And as I said, always with orthobiotomy, less is more. So you don't have to do a lot of anything. So I lay there for a while, and I can feel my back and my spine straightening up all the way up to my shoulder blades. So when you do that, pay attention after you've gotten relaxed. Pay attention. See if your legs want to go out like that. If you want to cross your ankles, see what feels good to you. It's not trying to have a routine, but just relaxing into this and sensing what your body wants to do and allowing your body to do that. So this feels pretty good. And then I can bring my knees back this way. This feels good to me. I just felt something release in my sacrum. So you may feel that. You may feel many things going on, but just sense the best time to do this is when nobody else is bothering you, when kids and family go to a quiet place. This is something that I have put on my bed and slept with when my back was really tight. So as I moved my feet up, because that just felt comfortable, I unconsciously did that. I moved my feet closer so my knees were closer to my chest. So I'm just laying there like that. And then you may decide you want to cross your ankles. That doesn't feel as comfortable as this. So I'm just letting my legs fall apart, have my ankles crossed, or you may put your feet together like this and just see how far your knees go out. So that what you're doing is you're relaxing this part down into your pelvis, which helps the sacrum and the low back. And you're also relaxing, like my feet are relaxing, and you maybe want to rotate your ankles one at a time or both of them together. You may want to put your feet together. Whatever your body does comfortably, do not cause your body stress. Do whatever feels comfortable and don't overdo it. Don't do it aggressively. Don't cause yourself any pain. That's not what this is about. This is just allowing your back to sink in, which I feel my low back and my body is kind of shifting to the side. So you may feel many different things going on. If you have a problem that seems like it's not releasing, you can do this. Put your hand on your knee, one knee or the other one. This one just feels like I wanted to do it with this one. So I'm putting my hand on my knee, and I'm just letting the weight of my arms push straight down into my hip joint. So I'm not pressing or stretching, but see how relaxed my hands are? So I'm just letting that little bit of weight go down into my hip joint. That feels really good. And I feel my knee and leg and thigh moving out just from that little bit, because that released the tension in this joint. And there, that feels a lot better. And that just relaxed that whole side. So now I'm going to try it with the other side. And I'm getting a position that just feels comfortable, and I'm just letting the weight of my hand and arm, I'm not pressing down, I'm just allowing the weight of my hand to press straight down this way into that hip joint. And as that's happening, I feel it all across the lower back, across the sacral area and the lumbar area. And all of a sudden I felt something come up to this shoulder. So that just shows you how you'll get to know, because this shows you how your whole nervous system is connected. So as you can see, now this leg is falling further out. So that's opening up this part and relaxing back here. So that feels good. So what you should do actually is just sort of stay that way for a while, and it may release some more. But you get the idea how comfortable this can be, and you can do many things with it. If you want to and you're flexible enough, you can bring your feet up and just rest your insteps on the edge of there. That feels good too. That's stretching up higher on my back. It just feels very good that way. So that is the back relaxation. It releases so much through the pelvis, the knees, the ankles and feet get to relax for a while because you're not standing on them. And this really is good for the back and the psoas. So that's that. And I could stay here all night if I didn't have to stop this video. So any questions or comments, you can leave them on the channel and for this video. Now I have to get up to stop the video, so here we go. And I'm just going to always be very tender and careful with your body.